Hey folks, welcome back. Missed you guys. So today I'm going to chat about why I chose radiology as a re-applicant. I applied to ortho the first time, I didn't match. I could have done general surgery. I could have, pursued another surgical specialty. Or I could have went into primary care, which for me is just not engaging enough for me to have a career in such things. But let me tell you, so all of the annoying things that are present in surgery, or the things that make surgery super difficult, are not present in radiology. So first thing is no standing. You don't have to sit there standing, looking over someone's shoulder, trying to reach all these tough angles. Your wrist hurts, your elbow hurts, your shoulder hurts. The ergonomics are present in radiology. They're just not there in surgery. It's just the nature of the career path. Someone's, the way their fracture pattern is, the way, that pocket deep in the X-lap is, you have to reach, you have to bend over. And even, as a prelim and as a med student, my neck hurt all the time, my back hurt all the time. When I'm retracting, my shoulders hurting, my elbows are hurting. I'm in a tough position. And I felt like in the long term, it wasn't sustainable. I'm going to break my body in the operating room. It might not be true for some people. Maybe some people adapt quickly to the ergonomic aspect, but for me, it was just something I was always bummed about. There's no downtime. Radiology, it's seamless. One study, the next study, the next study. Maybe they don't load super fast. That's all I've seen sometimes, but there's no, I got a case booked at 8:30 and then another case booked at 2 p.m. and there's 3 hours of downtime in between. There's none of that in radiology, which makes you be able to enter flow state, something that I really value and I really enjoyed, especially when I studied for steps, to be able to just get in the zone and just, move on, question after question, case after case, image after image. That's something that I really enjoy. There's none of this double scrubbing thing where you can't see, where you're standing behind somebody, where you're just waiting for an opportunity to do something. When you're in the reading room, you can see because there's 3 screens or 2 screens are huge, and you're sitting, to the right of the radiologist, to the left of the radiologist, and they're teaching you, and what they see, you see. At least your eyes, maybe what they recognize, you don't recognize, but you have the opportunity where you're not kind of just stuck useless or just stuck waiting. And that, of course, as an attending in surgery doesn't apply, but as a resident, as a med student, it was just such a terrible experience, I felt like. There's no cancellations also. So, how many times have you been in the operating room and the potassium was too low, so anesthesia had to cancel, or, someone had to double, triple check and ask the patient, when was the last time you had a sip of anything? And it turns out 7.5 hours ago, they had a sip of coffee. So, man, they don't meet the 8-hour mark anymore. So now, suddenly, the whole OR schedule is shifted. I hated that stuff. I want predictability. So the other thing is there's no emergencies in radiology like there is in surgery. I'll tell you the story. I was talking to one of my co-interns who's going to vascular, and I was telling her, next year, the year after that, 10 years later, you're gonna be finishing a shift. You're gonna be at your car, turning on the keys, just about to head home, and what's gonna happen? You're gonna get a page. I couldn't palpate that pulse. You're gonna have to go back in to the hospital. Same thing with ortho. You're going to get a page for compartment syndrome. So many times. And how often is it going to be compartment syndrome? Very rarely. So the fact of not knowing when you're actually done, and the fact that in radiology, when you're done, that's just a huge perk, I think, and something else. So, people might not talk about this stuff because of the culture or whatever, but I just want to be honest and tell you guys. Now, here are the things that super excite me about radiology and why I chose to do it. So first of all, just by the nature of being interested in ortho, I mean, I'm super interested in MSK imaging, and that was a huge part of my away rotations that I enjoyed. I loved looking at scans before the operating room. I loved going over scans with patients in clinic. I love telling them, like, this is what the MRI shows. Oh, here's your cartilage right here. This is the wear pattern. This is a fracture. Look at the healing. This implant hasn't shifted. Looks like you're healing well, etc., etc. Love that imaging aspect of it. And so it was just natural for me to go to radiology. But there's so many other good things about radiology. You're helping a ton of people. In one day you can read like 100 studies, 130 studies. You're helping a ton of people quickly, seamlessly. Of course, there's times where there's a tough diagnosis, but for the most part, it's bread and butter, of course. The other thing is it's minimally invasive in the sense that, yeah, you're exposing people to radiation, but you're not subjecting people to the risk of infection, blood loss, all of the things that are, of course, necessary for surgery to save their life in some cases, but you just don't have to deal with that. And you're able to help and contribute to the surgical planning so much. Reverse shoulder arthroplasty and even anatomical shoulder arthroplasty, other implants, pathologies in the belly where fluid collections, appendicitis even. I mean, very basic thing. Just yesterday, I had to call the radiologist and talk to them about appendicitis and the surgical plan because my attending wanted that. So, you're contributing to the operating room regardless as a radiologist. The other beautiful thing is the broad pathology. So, I did well in step one. I did well in med school, and I enjoyed studying and knowing things. Of course, now I've come to realize there's probably a lot of knowledge that I've accumulated that didn't help me in medicine, didn't help me towards ortho. But the fact is, you're taught, you spend the first 2 years of med school learning a bunch of stuff, and then you can go into a specialty where you basically don't use any of it or use very little of it. With radiology, you still get to dabble in all of these things. You get to dabble in OB, you get to dabble in pulmonology, you get to dabble in neuro. And it's fun, to look at the brain, and then suddenly the next day you're looking at, bones, and the next minute you're looking at the heart. I mean, it's cool to just keep it diverse. So the other thing that put radiology kind of similar to ortho in terms of pay, radiology is pretty much just as lucrative as ortho, or it can be. The only difference is that there's not as much room for industry contracts and implant design and stuff like that. So, an orthopedic surgeon maybe has the ability to make upwards of, $3-4 million. Things I've heard, I've never seen. But I'm happy with a radiology salary. Whereas I don't know if I'd be as happy with a primary care, internal medicine, family medicine salary. The other thing is, super flexible. I can go into ESIR and do interventional and get right back into OR if I want. And when I do that, I can still do 1 day DR, 1 day IR, or half days, or whatever. I can do MSK radiology, I can do breast, I can do neuro. So that flexibility and the fact that radiologists typically are reading, even if they're specialized, you're reading everything. That's super fun. That's something that I don't want to give up. One thing that I love about radiology, it's super in demand. It's only going to get more in demand. Imaging is like the foundation of medicine now. Everyone's getting a chest x-ray. Everyone's getting a CT scan. Sometimes they're getting them unnecessarily. Imaging stewardship might be something that's going to be taught just like antibiotic stewardship is taught in school, but radiology is super in demand. And it's evolving. The artificial intelligence thing, I don't think it's a threat. I think it's going to be a supplement. I think it's going to make radiology even more amazing than it is. The other thing I love about radiology versus surgery is, you can't start learning to operate on your own. You can't just learn to operate at home. For you to learn to operate, you have to spend 6 months in the OR shadowing or watching or double, triple scrubbing. And then when you're a second year resident, now you're really learning to operate. In radiology, though, you're learning from day one how to read scans. It can be self-taught in a lot of ways, and you can really start to immerse yourself in it instantly. So those are just my thoughts about a reapplicant, especially, coming from the ortho perspective. Hope it helps.